So, dear friends, today we are going to discuss pulse diagnosis or Nadi Pariksha. So, the pulse diagnosis or the Nadi Pariksha is the very important diagnostic tool. We can see as per this first image, and we can see as per this second image. So, there are three positions of the pulse and three level of the pulse. We will discussing them. कि पल्स की तीन पोजीशन होती हैं और इसके तीन लेवल होते हैं. सो फर्स्ट आई वुड लाइक टू टेल यू अबाउट द रेडियल पल्स. पहले हम रेडियल पल्स की बात करते हैं. सो व्हाट इज द रेडियल पल्स? हमारी रेडियल हमारी जो रेडियल पल्स का मतलब क्या है? सो व्हाट इज द मीनिंग ऑफ रेडियल पल्स? वी आर चेकिंग इन द TCM. हम क्या चेक करते हैं इसमें? What we are checking? So would like to bring focus. 1 minute. So I would like to show you the location of radial artery. हम radial artery की एक बार location देख लेते हैं. So we can see here in the wrist area, we can see this red one. ये हमारी radial artery है. This one. We can see this is the radial artery. So we are talking about this and we are checking this one. हम इसे check करते हैं. हम radial artery को check करते हैं, right? So whenever we talk about the radius bone, जब हम radius bone को देखें, so look at the radius bone. This is the radius bone. ये हमारी radius bone है. ये इसका जो उठा हुआ भाग है, there is एक उठा हुआ जो भाग है, that is called styloid process of the radius bone. ये इसका styloid process है. यहां पर हमारी middle finger आती है. We are keeping the middle finger here on the styloid process. Whenever we are placing our finger, जब भी हम अपनी फिंगर को प्लेस करते हैं तो यहां पर हमारी मिडिल फिंगर आती है on the styloid process. So we are keeping the middle finger on the styloid process, one finger before and the one finger after. So we are keeping the three finger one after another. हम तीन फिंगर को रखते हैं ऐसे. एक फिंगर को यहां रखा. Now we can feel the styloid process. If you rub your hand, you will feel some elevated part. That is the styloid process. So we are keeping the middle finger on the styloid process. One hand, one finger before and one finger after that. So we will be keeping three finger here. And we are checking the radial artery. In the Ayurveda, we are keep telling it Vata, and Pitta and Kapha. In the Ayurveda, we are telling this. But in the TCM, we are telling Chun, CUN, Guan, and Chi. So during my training, I have taken the training of Nadi Pariksha under many great teachers. Everyone is keeping the hand on different location. In the Chinese acupuncture, most of the people keeping the hand like this, finger like this, only index finger on the root of the thumb, middle finger on the styloid process, then the ring finger. So we can feel this styloid process. This is the middle finger is coming here. But in the Ayurveda, we are not keeping the finger like this. In the Ayurveda, we are crossing the styloid process. हम styloid process को पहले cross करते हैं. If this is the styloid process. So we are crossing the styloid process and we are going be proximal to that. इसके पार चले जाते हैं, वहां पर हम पहली फिंगर रखते हैं, फिर दूसरी, फिर तीसरी. This is the Ayurveda way of checking the pulse. Okay, so we will be discussing both. रीडिंग दोनों जगह से मिलती है. So now we can see in this image here. The first position is called Chun, then the Guan, then the Chi. 1, 2, and 3. So we will be keeping the hand in this way. हम इस तरह से अपने हाथों को रखते हैं on the radial artery. So this is called radial pulse. तो क्या why we are telling it radial pulse? हम इसे radial pulse क्यों कहते हैं? Generally, Ayurveda practitioner just will do नाड़ी परीक्षा here only. यहीं पर करते हैं आयुर्वेदा के डॉक्टर, even the Chinese practitioner. But there are many area of the body where we can check the pulse. हमारे शरीर में से 9 regions होते हैं जहां पर पल्स को चेक किया जाता है, especially in the TCM. In the Ayurveda also, we are checking the nadi at many places. So let's discuss here in the Huang Di Nijing book, Su Wen. The name of the book is Su Wen. So has described the 9 reason of the pulse. पल्स के 9 स्थान होते हैं जहां पर चेक की जा सकती है. So number 1 place is Taiyang, which is telling what is the condition of the chi in the head region. Taiyang में पल्स चेक करते हैं यहां पर. This is the Taiyang, where the eye are ending, the corner of the eyes. From there, if we go back, we will find the depression here. That is Taiyang. So checking the pulse here. And we are finding the pulse is very fast. There is excessive energy in the head region. Pulse is very slow. There is a poor energy in the head region. And slowly we will understand what type of pulse is. Accordingly, we can do the diagnosis. उसके अनुसार हम diagnosis कर सकते हैं. So this is the place of Taiyang. ये हमारे ताइयांग का स्थान है. The second place is stomach 3. दूसरा जो स्थान है, the second place. We are checking the pulse on the area of stomach 3. Okay. It is telling the chi of the mouth कि हमारे मुंह की ऊर्जा कैसी है. हमारे not only mouth, even telling about the upper digestive tract, stomach 3. So just we are seeing where pulse can be checked. कहाँ पर pulse check की जा सकती है. This is the location of stomach 3. If we keep the hand here in the mid-pupillary line, this is the area. If we check the pulse here, it is telling the condition and the energy of the mouth. Okay. So in the head region, we are checking the pulse at three places. Number one, Taiyang. That is called upper head pulse. Number two, stomach. Three, which is called middle head pulse. And number three, lower head pulse. Three pulse we are checking in the head region. तीन नाड़ी को हम हेड रीजन में चेक करते हैं. So this is the lower head. Lower head. It is the triple warmer 21 corresponding the chi of ear and the eyes. So it is explaining the energy of the ear and eyes. Triple warmer 21 or the Senjaya 21. So we can see the triple warmer 21 here. We can see triple warmer 20. We can see the pulse here. We can feel the pulse here. A very strong pulse, there is excessive chi in the ear or eyes. If the poor pulse, there is a poor energy in the ear and eyes. So this is the location of triple warmer 21. That is the third pulse. So we have checked the pulse on the Taiyang or the upper head, stomach 3 or the middle head, triple warmer 21 or the lower head. तीन जगह pulse check की. Suppose one person is having headache. You want to find out whether headache because of low BP or the high BP, whether headache because of the low energy or the high energy. Keeping the hand on the ताइयांग. आपने ताइयांग में हाथ को रखा. You were okay. It's a too high energy headache because of the high BP or headache because of the excessive energy. But you are feeling very weak and feeble pulse. You're feeling very feeble pulse. It is because of the low energy. So this is the landmark telling what is the condition of the energy in this part. This is the landmark telling energy of the mouth and the upper digestive tract. And this is the landmark telling what is the problem in the eyes and the ear. So 3 pulse out of 9 is in the head region called upper head, middle head, lower head pulse. Now we will be going upper hand, middle hand, and the lower hand pulse. Then the upper leg, middle leg, and the lower leg pulse. That is a 9 pulse. 3 pulse of head, 3 pulses arm, and 3 pulse of the leg. Upper head, middle head, lower head. Upper hand, middle hand, lower hand. Upper leg, middle leg, lower leg. So there are total 9 pulse has been explained in the TCM. So let's see here. Hand pulse. Now the upper hand pulse, it is the pulse what we are talking about, lung 8. Lung 8. It is indicating what is the condition of the chi of lungs. हमारे लंग की क्या कंडीशन है? So lung 8 कहां पर होता है? Lung 8 वहीं पर होता है जहां पर हम नाड़ी चेक करते हैं. So let's see now here. So this is the location of lung 8. Lung 8 point located on the thumb side. One chin proximal from the wrist. हमारे wrist से एक चुन ऊपर, that is the lung 8. Here this is the place from where radial artery is passing. So we are keeping the hand on the lung 8. हम lung 8 पर अपना हाथ रखते हैं, जो लगभग लगभग स्टाइलर प्रोसेस के पास में आ जाता है. It is telling what is the condition of lung chi. Person is suffering with the lung problem. You don't know whether the problem is because of the excessive energy of the lung or the deficient energy of the lung, क्योंकि lung में problem तो दोनों से हो सकती है. Okay, we are going on the wrist crease, that is lung 9, one chun proximal, that is lung 8. Okay, very fast pulse. So excessive energy in the lung, very feeble and the poor pulse. That is telling the poor energy in the lungs. Yes. So upper hand pulse. Now the middle hand. So we will be checking the pulse at LI4 area. LI4, middle hand. So that first we have seen the condition of lungs. Now we'll be seeing the condition of mid-thorax area, mid-thorax region. अब हम mid-thorax region की ऊर्जा को देखेंगे. So actually, if we see the chest cavity, अगर हम छाती की बात करें, there are number 1 we have lungs, number 2 we have heart, and many other structure. So this is the upper thoracic area. This is the middle thoracic area, upper thoracic area, and where the we can consider if this is a thoracic area, right? This is the thoracic area. Upper thoracic, middle thoracic, lower thoracic. Upper thoracic, lung 8, and the condition of lung. Middle thoracic, about this middle part. Lower thoracic, about the heart. The condition of the heart, because heart is located at the lower area. Yeah. So upper thoracic, we will check with the help of lung 8. Middle thoracic will check with the help of LI4. Lower thoracic will check with the help of heart 7. Everywhere we have pulse. In the TCM, we will be checking the pulse like this, even like this, even like this. We will checking the pulse in a very different way in the TCM. So we will be checking the pulse on the lung 8. Just calm down and be aware. We will be seeing how to check the pulse. We will be understanding that point, how to check the pulse, right? Just keep the hand here. Slow down, calm down your brain. Be aware what's happening there. Today I'm just telling keeping the hand. Then I will tell you the levels. Just keeping the hand here. Throbbing, excessive energy in the lung. Very weak, poor energy in the lung. तो हमें पता चल जाएगा कि लंग की क्या कंडीशन है. Then we will be coming to the LI4. हम LI4 पर आएंगे. Even we can use a thumb to check the pulse. This is the mid-thorax area. some very fast pulse or the slow pulse. Accordingly, we will understand the condition of mid-thorax area, then the heart 7. I am checking the pulse on the heart 7. Okay. And just try to understand what is the condition of heart chi. Heart chi की क्या condition है? So ultimately, there are network of arteries is spreading all around in the body. Here we have checked. Here we were checking the radial artery on the thumb side. And here we are checking the ulnar artery. तो ये हमारी ulnar artery, which we are checking for the heart chi. And here we were checking the radial artery, which we are checking for the lung chi. Or we are telling it upper hand pulse. The middle hand will be Li4 and the lower hand pulse, heart chi. If we are going toward the Li4, अगर हम Li4 पर जाएं, so we will find the pulse here also. Sometimes we are putting the needle and we can see blood is coming. So we have multiple group of arteries there. Okay. So upper hand pulse lung 8 for lungs, middle hand pulse Li4 for mid-thorax region, and the lower hand pulse heart 7. It's indicating the chi of heart. So we have completed upper head, middle and the lower head, upper hand, middle and the lower hand. Let's come back to the legs. In the leg, upper leg, that is, we are checking in the knee. Middle leg, that is checking at the kidney 3. And the lower leg, we are checking on the feet. Feet में check करते. So the upper leg or upper leg above the knee, above the knee. I will tell you the location because it's the liver tan. Sorry, it's not the knee. It's liver tan. So we are checking liver tan. We are checking kidney 3 and we are checking stomach 42. And there is the option of the liver 10, that is liver 3, because sometimes liver 10 is very difficult to check. So let's see here. The location of the liver 10, and if not possible in the liver 10, then we'll go to the liver 3. First, let's check the liver 10. So this is a very important area, liver 10. We find the inguinal pulse here. यहाँ पर हमें inguinal pulse मिलती है. The inguinal pulse is telling about the condition of liver as well as what is the condition of the genital part. If there is any problem, the genital part, if there is any problem, the ovary of the testes or the uterus, for that we are checking the liver 10. बट हाउ टू लोकेट द लिवर 10? लिवर 10 को लोकेट कैसे करें? इट्स नॉट डिफिकल्ट, इट्स वेरी इजी. So let's see now. So this is the location of liver 10 here. We can see the liver meridian. From the stomach 30, we have to go 3 chun down. हमें stomach 30 से 3 चुन नीचे जाना होगा. पहले हमें stomach 30 को लोकेट करना होगा. And from the stomach 30, we will be moving the 3 chun down. Remember stomach 30. Now where is the stomach 30? एक बार हम stomach 30 देख लेते. Stomach 30, locating the stomach 30 is very easy task. Let's see now. So we can feel the bone here, bony margin here, pubic bone here. From the center if we go, ये हमारी bone है. हमें bone से जाना है. So this is the navel area, and we know stomach meridian is 2 chun apart from the navel area. So we will find the stomach 30 here. नाभि के लेवल पर जो पॉइंट होता है दैट इज स्टमक 25, देन 26, देन 27, 28, 29 and 30. Stomach 30. Stomach meridian is 2 chun apart from the navel area. तो यहां पर जो बोन स्टार्ट होती है, जस्ट स्टार्टिंग ऑफ द बोन, दैट इज द लेवल ऑफ स्टमक 30. From the stomach 30 we have to go 3 chun down, that is liver 10, where we can feel the inguinal pulse, जहां पर हम inguinal pulse को फील कर सकते हैं. अंडरस्टूड? कैसे स्टमक 30 को फाइंड आउट करना है और कैसे इंग्वाइनल पल्स पर जाना है. इज इट क्लियर? क्लियर. हाउ टू गो टू द इंग्वाइनल पल्स? फॉर मेनी पर्संस, if you want to find out if any problem in the genital area, it's a good idea to check the inguinal pulse. Sometimes it's not practical. Then what to do? Then check the liver 3. कभी ये प्रैक्टिकल नहीं भी हो सकता, तो क्या करें? तो फिर लिवर 3 पर जाइए. लिवर 3 सेकंड नंबर है. Then we'll be moving to the liver 3. On the liver 3, we'll find the pulse that is also telling what is the condition of the genital part and what is the condition of the liver. So this is the upper leg pulse. We are checking on the liver 10 or in the liver 3. Purpose, what is the condition of liver, what is the condition of genital part or the inguinal area. Inguinal area की क्या परिस्थिति है, कंडीशन है, और genital part की क्या कंडीशन है. So we'll find the pulse here. The second pulse, that is the lower leg. हमने बताया lower leg pulse means kidney 3. We are keeping our finger on the kidney 3 and we'll finding the pulse here. ये किडनी की कंडीशन बताएगा. What is the condition of kidney, which can be identified from the kidney 3. Kidney is deficient, pulse will be very feeble. अगर किडनी कमजोर होगी, यह पल्स भी कमजोर होगी. Okay. So this is the middle leg pulse. So upper leg pulse, liver 10 or the liver 3 will reflect the chi of the liver, जो हमारे liver की chi को reflect करती है, और genital part, upper leg. Then the middle leg pulse, kidney 3, which is telling the condition of kidney chi, जो kidney की ऊर्जा को बताता है. We know the kidneys connect with the kidney, kidneys connect the bones and many other problems. Now the lower leg. Lower leg means stomach 42, which is telling the condition of spleen and stomach. Stomach 42 is very easy to identify. Stomach 42. So look at in this image, stomach 42 found on the feet. ये हमारी feet में पाया जाता है. So we can see in this image here. From the ankle joint, we have to go 1.5 tune down or the distal. Ankle joint से हम 1.5 tune नीचे आ जाते हैं. This is the ankle joint and we are going 1.5 tune down. Exactly in the center. Or 2 finger down, we can measure with the help of 2 finger. So this is the lower leg pulse. You can keep the hand here and you will find the pulse. आप जब यहाँ पर हाथ रखेंगे तो आपको यहाँ पर पल्स मिलेगी. This is telling the condition about the stomach and spleen. ये stomach और spleen की condition को बताता है. The other option is given here. दूसरा option क्या है? Other option is less practical, that is spleen 11, but definitely sometime possible. Spleen 11 also the another option. We can see here spleen 11 is the point. Okay, we can check. It is located in the leg region. ये हमारे leg region में available होता है spleen 11. तो देखिए spleen 11 को नापने का तरीका क्या है. देखिए बड़ा ही आसान सा तरीका है. Spleen 11. So we have to be on the spleen meridian. हमें spleen meridian में रहना है. We are drawing this line from spleen 10 to full leg length. This is the location of spleen. So look at here now. From the spleen 10, ये देखिए, this is the knee joint. ये हमारा knee joint है. This is the knee joint. The lower border of the patella bone. हमारी patella का lower border. And entire leg, just a midpoint is spleen 11. Just you take the midpoint of the thigh, that is spleen 11. Another option that is more practical option, from the spleen 10, if you go 6 tune above, that is spleen 11. जो option आपको ठीक लगे. So this is the lower leg. तो हमने देखा कि stomach 42 is more easy in this area, but this is also the option. We should explore all the options. So in this way, these options has been given in the TCM. There are 9 reasons of the pulse: upper head, middle head, lower head, upper hand, middle hand, lower hand, upper leg, middle leg, lower leg. We can check the pulse at these 9 areas. Right now, the most convenient area is the radial pulse, which we are checking for everything. Okay, जिसे हम चेक करते हैं. लेकिन आज से आपको चेक करना है. If you want to find out the condition of kidney, keep hand kidney 3 on the kidney 3. If you want to find out the condition of stomach, just keep your finger on the stomach 42. You want to find out what is the condition of the lungs, bring your finger on the lung 8. Heart 7. For the condition of the head, thigh, ear, eyes, triple hormone 21, stomach 3 from mouth, for mouth. In this way, इस तरह से आपको, दिस इज अ होमवर्क फॉर टुडे, कम से कम 3 लोगों की आपको हर पॉइंट पर 1-1 मिनट फिंगर रखना है, कुछ भी समझने की कोशिश नहीं करना. Try to become thoughtless, because pulse diagnosis only can be done if you are aware, because we will not be checking only throbbing. हम केवल throbbing चेक नहीं करेंगे, we'll be checking the many things. तो आपका ये होमवर्क होगा कि सभी 9 पल्स को आपको समझना होगा. फिर हम आपको बताएंगे वंडरफुल पल्स एज पर आयुर्वेदा, हाउ टू चेक वाता पित्त एंड कफा. ओके, सो इनफ फॉर टुडे, नाउ विल कंटिन्यू टुमारो. अब हम कल मिलेंगे इसी समय. थैंक यू सो मच. 5:30 PM, क्लोजिंग द सेशन.